Welcome to 10 with Dr. T, featuring Dr. Matthew Terzella. Brought to you by Piedmont Physical Medicine and Rehabilitation.
Hi, this is Dr. Matthew Terzella from Piedmont Physical Medicine and Rehabilitation in Greenville, South Carolina, and welcome to another edition of 10 with Dr. T. Today we'll be talking about something that many of you potentially have heard in the popular media, the idea of platelet rich plasma, or PRP. For any of you who are sports nuts like myself, you probably hear this term bandied about quite regularly, and you may be wondering, like, what the heck is it? Why does everybody keep talking about it, and what does it actually do? Again, this is something that's near and dear to me because I have several family members who consistently ask about what it is, because there are a lot of weekend warriors in my family, so they ask about ways that they could circumvent injury or potentially prevent it, or just feel better so they can continue to play the sports that they love. Some of you, if you're old enough to remember, like myself, back when the late Kobe Bryant was still playing, he went to Europe to get a mysterious blood spinning treatment, and everyone was all like, "Oh, what is this blood spinning treatment?" It sounded almost like some CIA undercover operation. But in fact, all it really was platelet-rich plasma. It had not caught on as much in the United States at that point, and Europe had been doing it for quite some time. I believe he had a knee injury that they felt could potentially help him heal as he went moving forward. And it did help him heal, that in conjunction with the weight of an entire Los Angeles Lakers organization around him really did help him get a lot better, but it did play an important role in helping him heal. So again, the question always is, well, what is PRP? I don't know what that is. Well, again, it stands for platelet-rich plasma. All of us have platelets in our blood. All of us have plasma. So the good thing is this particular treatment option, which is what it is, a treatment option, comes from our own body. And this is a really, really good thing. Your platelets play a role in inflammation, and there are a lot of other inflammatory markers, for lack of a better term, healing factors in your blood that really govern our healing response. For instance, when you cut yourself or nick yourself, you'll see you get a little bit of localized swelling, you'll see it clot over, you'll see it heal up, and those are the things in your blood that are playing that role. Now, some of these areas that get injured, your body will respond in the same way. Then you wonder, well, why doesn't it heal on its own all the way? Well, different mechanical stressors, blood supply to an area really affects it. That's why it doesn't always work the way we want it to work. So some brilliant scientists and physicians and maybe even some engineers all got together over time and said, well, why don't we find a way to direct our own healing factors to the spot that needs it the most? And what happened was platelet-rich plasma. So the question always is also, well, what is it used for? Can I use it for just about anything? Well, we tend to use it for in the musculoskeletal injuries like tendons, even muscle, and ligaments. But you can also use it I've used it in joints as well, like hip joints and knee joints, for anything that is there any type of derangement or any type of injury in there. It can really help heal that. It's particularly useful for some of the ligamentous and tendinous structures because the blood supply to those areas isn't always the best. It's just the way we're designed. So this is a good way to get reinforcements where we really need to get them. Next question is, oh boy, well, how are you going to do that? I don't understand this. How, if I have this miraculous stuff in my body, how do I get it out? Well, it's quite simple. It's a simple blood draw, and that blood is spun down in a centrifuge, and the platelets and the plasma are separated from the red stuff. So you have this clear yellowish stuff. Some patients joke that it looks like urine, and it kind of does. And you have the red stuff. And so you siphon off the clear stuff into a syringe, and there's your injectable substance. And that's really all there is to it. Now, how do we know where to go? Well, the imaging plays a role in this. Some folks will have MRI scans that we look at. Others will have X-ray. We like to use diagnostic ultrasound because that actually gives us a real-time view, and we can really get down to the nitty-gritty, specifically when it comes to ligaments and tendons. It can really help us direct our treatment to the most appropriate place. So the next question I always get is, well, does this hurt? Well, needle's always going to feel something. It's a sharp needle, which you'd never want a dull needle. You want a sharp needle. And there will be soreness for at least anywhere from 1 to 3 days after. I found that this kind of varies from person to person and to how they respond to these particular injections or injections in general. So this is something that that could be a little bit sore for the first few days, but most people do pretty well afterwards. They'll notice a drop off, and then they'll continue to see an improvement. Obviously, the following question is, well, when can I start seeing improvement? I've seen it anywhere from a week or two to up to 4 to 6 weeks out. There are varying studies out there that some say you could see benefits from it for many months later. Others say only within 6 weeks. What I've seen is 4 to 6 weeks is usually the most healing that happens. That is not to say it doesn't stimulate healing and your body continues to heal. It's just like the most subjective form of improvement you'll see in the first 4 to 6 weeks. Now, I have had good success in how it lasts quite some time. There are a few folks, depending on the injury, who do have to revisit it. Other practices will put it in every 2 weeks for 2 to 3 times. I've seen that, and that's not wrong. That's a way to approach it too. But I've also seen it from doing once and seeing where you are several months later and see if you need to boost it up a little bit. So there's really no set way of doing it. Everyone has their way of performing it and what they would expect. Now, the rehabilitation after it completely depends on the injury and the person. That's a lot to get into in a 8 to 10 minute podcast, but suffice it to say, there will be some physical therapy afterwards to help stabilize and strengthen the muscles around any joint, and there will be a graded response in terms of returning to play. A lot of this depends on what they do and what their goals are as an athlete or as just in day-to-day function. So those are the popular questions. Hey, can I go work out? Can I do this? And oftentimes I have to rein them in a little bit and go slow. The key for this is also follow-up. You want to be able to see the patient. You guys need to be seen every couple of weeks or maybe every month at least for a decent amount of time, usually 2 to 3 months, just to make sure you're progressing in the right direction and you're sticking to the plan. That's really, really important, because if you don't stick to the plan and push it too far, like I like to tell some of my patients, it's not an invincibility cloak. It doesn't mean you're never going to get hurt again. You can't push it too far. You have to allow the healing to take place. And that's really, really important, not just in this, but in anything. The other question I get, which I love answering, is how does it work? Is this magic? No, I wish it were magic. I wish I could just go poof and you feel better, but that's not quite how it works. Again, all of your healing factors are concentrated into this one area of your plasma, and that concentrated plasma is what we're directing towards the injured tissue. Once that happens, it directs your body to go to that area and to heal it and to focus some of its healing capabilities on that specific area. And that's really how it works. It's not magic, but it is really pretty cool to see how people can really improve. And some have said it's given them their life back. So it's really, really important. It's really important to understand what it does. And it's also really gratifying to see people improve. All right. Now, we just focused today just on the platelet-rich plasma. There are a host of other things that could be done regenerative-wise. You've heard all of them. You've heard about the stem cell debate. You've heard about exosomes. You've heard about or nanoparticle technology. These are all things that are out there. Eventually, we will cover a bit more as we go through our series. But my take-home to you is, if you have a question about any injury, whether it be muscular, tendon, ligament, or joint, in the musculoskeletal realm, talk to your doctor, see what you could do, get the ball rolling, take a look at what imaging you can get, whether it be x-rays or MRIs or even ultrasounds, and then explore your options with your physician. That way you have a wide variety of things to choose from as you move forward. I would also, another tip is to understand what your goals are. If your goals are to sit on the couch and that's it, well, great, but have realistic expectations. If your goals are to get out there and play at a high level of athletics, then be more aggressive in how you approach these type of injuries, because it can make a difference. So also have some reasonable expectations. This stuff is not miracle. It's not a miracle. We're not miracle workers. It's just something that we can do to really help you moving forward. Like, for instance, I mentioned my father before. He's 74 years old, plays softball still. I'm trying to get him down to South Carolina so I could do his knees with some platelet rich plasma. I do think it will really help him. And I think I finally convinced him, which is no small feat, to convince a 74-year-old Italian American to do something. So I'm I'm pretty happy about that. But my point is, if there's something there and you want to explore other options, have an open, frank discussion with your physician and see what's out there. Now, I hope you enjoyed this podcast. Don't forget to follow us and rate us if you feel the need to do so. You could also go to my website at www.piedmontpmr.com, www.piedmontpmr.com. We have a host of other information on there that could potentially answer some of the questions that you have. In any case, thank you very much for your time. Hope you have a great day and a great week, and look to see you next time. Bye.
Thanks for listening to 10 with Dr. T. To learn more about resolving your physical pain, visit PiedmontPMR.com.